Now, following criticism here in Germany of the pace of the coronavirus vaccination rollout, a health ministry official has revealed that Berlin has struck preliminary deals for an extra 50 million vaccine doses in the summer, outside what's been negotiated by the EU. December was the deadliest month of the pandemic so far in Germany, and the number of daily deaths remains high, reaching a new record on Friday. Pressure is high to protect vulnerable groups by quickly rolling out vaccines. But some predictions in German media say if the pace of inoculation continues as it is now, herd immunity would not be reached until 2027.
A quick temperature check, and then the shipment is good to go. Here in eastern Germany, more doses of Pfizer-BioNTech's coronavirus vaccine are arriving by the day. They're just some of the 600,000 doses that are reaching vaccination centers throughout the country on Friday. But that hasn't silenced critics of the German government's handling of the vaccine rollout. Too little vaccine, confusing registration processes, and a slow vaccination timetable. The list of complaints is long. But the German government is standing by its program. And at this vaccination center in Western Germany, recipients say the wait was worth it. For me, it's like winning the lottery. My children didn't allow me to leave the house. I had to stay at home all the time. So it's great being among the first ones to get the shot. Despite the bumpy rollout, there could be some relief in sight. With a deal inked to secure millions of new doses of vaccine and the possible approval of a third vaccine by month's end, the EU is taking steps it hopes will silence the critics of its vaccine rollout.
We're joined now by Peter Kremsner, professor of tropical medicine at the renowned University of Tubingen in southwest Germany. Professor, thank you so much for joining us here on DW. With all these glitches in Germany's vaccine rollout, could it really take years to reach herd immunity in the country?
Well, that is a bit of a sad news, and I do not believe that. However, if we speak of herd immunity, we really mean good immunity that would imply also a protection against infection. And we cannot say a lot about this. So probably we need the infection itself to have such a protection, or we need likely better vaccines to reach herd immunity. But one other way is to protect against COVID-19, the disease itself, and especially the more severe forms of the disease. And that is possible with the currently used vaccines. I'm very hopeful that this will take place, and also very soon.
There's been a lot of debate, of course, about delaying the second dose of COVID-19 vaccine so more people can receive the first dose earlier. Is that a good idea?
Well, there is some flexibility. Usually as doctors, we have to adhere to what is approved by the regulatory authorities, and thus use the package insert and follow what is in there. So if it's 4 weeks time difference between first and second vaccination, it should be 4 weeks. However, on a daily basis, also here in our travel medicine department, for instance, we are very flexible, artistic, so to say. We always use other schedules because the people, they do not come back exactly 4 weeks after the first shot. They come back 8 weeks later, some even 2 years later. And we nevertheless, of course, vaccinate them, and we know that this is not harmful. In terms of immunogenicity, in terms of antibody production, for instance, it's rather better if you get a shot a bit later. However, as we do not know how long the protection will take after a first shot, it is better to adhere to the schedule. But whenever possible, a bit of a delay is certainly not a problem. I would be very flexible.
Yeah, and bottom line is I imagine that medical community is not going to go outside of what the clinical trials actually showed you. In other words, what the evidence is. Professor Peter Kremsner of Tubingen University, thank you so much for your time.
Thank you.
Now, an outbreak of COVID-19 has prompted Chinese officials to tell people in 2 cities south of Beijing to stay at home for 7 days. The cities in Hebei province have tightened lockdown measures, including a ban on public transportation. Nearly 350 people have tested positive so far. Around 3,000 medical staff have been mobilized to support mass testing of more than 11 million people. China says it'll provide coronavirus vaccines free of charge. Now, we're joined by Fabian Kremsner, a journalist in China and currently in Wuhan. Fabian, China has sealed off 2 cities following COVID-19 outbreaks, leaving 20 million people under strict lockdown. How great is the fear that the virus will spread?
I mean, also here in Wuhan, you see that more and more people are wearing masks again, and that there are more temperature checks and QR code registrations needed when you enter shops, for example. However, it's still quite remarkable that life goes on as normal. I'm just coming from a very crowded shopping mall. Yesterday, I was at a very crowded craft beer place. And I mean, it's basically life as normal here. But there's an underlying fear that there might be a second wave of COVID, definitely. Yeah.
Well, China's going to provide COVID-19 vaccines free of charge. Tell us more about the vaccination plan in the country.
Yeah, up to now, there are already 9 million doses that have been administered. That's actually quite a large number. And until Chinese New Year, that's in 1 month, around 50 million people are supposed to be vaccinated by then. However, I mean, with a massive population of 1.4 billion people, the relative number is still quite small. However, the Chinese vaccines, they have one advantage. That's they can be stored just in a normal fridge, so the logistics is actually quite easier, especially when they're also exported to developing countries.
Now, Fabian, China has confirmed that the World Health Organization will visit Wuhan to investigate the origins of the COVID-19 pandemic. What can we expect? When can we expect that to get underway?
Well, there are mixed signals. For example, the Health Commission here in Beijing today said we are very welcoming. We are just waiting for the WHO investigation to start. However, the WHO, they say that the visas have not been granted yet. And so we don't actually know when this will start. And the WHO is quite disappointed by the behavior of the Chinese government. That's remarkable because in the past they were quite understanding towards Beijing. You can say that Beijing is very afraid of this issue getting politicized. However, they themselves politicize the question of the origin of the virus really heavily. For example, here in Wuhan, there's an exhibition about the origin, and the story, how it's told here, is really a heroic story of the Communist Party winning the fight against the virus, and there's really no room for admitting mistakes or self-reflection.
Fabian Kremsner in Wuhan, China. Thanks for that update. Well, the UK has recorded its highest number of daily deaths from the coronavirus since the start of the pandemic, with a new variant that appears to be more transmissible surging across the country. Authorities are particularly alarmed by the situation in London. Mayor Sadiq Khan says the virus is, quote, out of control in the capital, and hospitals are facing breaking point. Well, we're joined now by our London correspondent, Birgit Maas. Hi, Birgit. Now, Britain's National Health Service says it's made plans to vaccinate all frontline staff against COVID-19 in the next few weeks. How realistic is that, though?
Well, hundreds of thousands of people are being vaccinated. So we know the latest figures are that in the last week, over 300,000 people were vaccinated. So the vaccination program here in the UK is seen as a success. However, when it comes to vaccination of frontline staff, of doctors and nurses, there are many critics, and they say that the government has not systematically prioritized frontline staff, that there was an ad hoc approach. It was said at the end of last year, yes, they should come first, but then that was taken back. And doctors and nurses have really implored the government to put them first, because if they can't go to work, if they are sick or they have to be isolating, then that is really hindering the whole vaccination effort and obviously putting enormous strain, much more strain on the UK Health Service that's already, particularly in London, really bursting. So they welcome this new approach, and hopefully we will see that this is really in the next weeks being made happen.
Well, indeed, there is a lot of pressure, particularly, as you said, in London now. The mayor there, Sadiq Khan, says the situation in the city is, quote, out of control, Birgit. Can you describe the atmosphere in the city at the moment?
I have to say it's very, very quiet. I'm really living in the centre of London. The streets are very quiet. The restaurants, bars are obviously closed. Only essential shops like supermarkets and pharmacies are open. I hear the sound of sirens much more now. It reminds me of in the first wave, I live near a very big hospital, and you do hear the sirens of the ambulance cars in the days and also in the night. So that is something, an eerie reminder of the crisis. Critics are saying, government critics are saying that it's actually not enough, and there are many doctors also are saying that this, even though it does seem to be quite quiet, that we need even more measures. So nurseries, for example, are open. People are allowed to go to some religious gatherings, and that they're saying with this new virus being so extremely transmissible that there needs to be even more of a change of behaviour, and people really do need to stay home even more.
All right, well, Birgit Maas in London, thanks for that update.
This isn't a waiting room, it's the treatment room for COVID patients at the hospital in Kajelica. One patient calls out to us to tell us she'd been sitting and waiting for 3 days, waiting for a bed to become free next door.
These one are too weak to sit on a chair, so we put them on the stretcher, and they are all on oxygen.
Dr. Susan Mukonkole has been working here for 9 years, and this pandemic is pushing him to his limits. A third of his colleagues here have already had the virus.
How do you feel to see your hospital that full?
Sometimes you feel powerless because you don't have enough space. Sometimes we don't have enough oxygen points. We need to improvise and see how we can split 1 point into 2 to give oxygen. Sometimes you have to choose to who do you give first the oxygen and who should wait. That sometimes is very stressful for us.
On average, one person with COVID dies in the hospital every day. There's a small room next door with somewhat better beds for acute patients waiting for an intensive care bed at another hospital. The local health minister admits that not everyone can get an ICU bed. Most are already full.
If the person qualifies for the ICU, it depends. But remember, even prior COVID, for ICU entry, there's always a scoring index. Yeah. The house is on fire.
So this is actually the waiting hall, the waiting area of the hospitals where people would normally wait for their treatment, but you can see it. People who come here with non-COVID related issues, emergencies, are for now being treated here because they need the space on the other side of the building for potential COVID cases.
South Africa, meanwhile, has reintroduced tougher lockdown measures. There's a stricter mask requirement, alcohol sales are banned, and beaches have been closed. But police are overwhelmed with enforcing the rules. Only patients over the age of 45 are now being tested at the state clinics. The demand is overwhelming. Here in Virologist Wolfgang Preiser's laboratory, every second test is positive. The peak of the second wave is expected in South Africa in mid-January, but even after that, experts anticipate further waves.
I fear that neither the current enormous surge that we are experiencing now, nor the arrival of a vaccine sometime into halfway through 2021 for a small proportion of the population will be able to make a big difference.
The government announced it is already in talks with vaccine manufacturers, but there are no details yet. Back in Kajelica, however, there is hope. Initial studies show that during the first wave, up to 40% of residents were already infected and possibly even immune. Social distancing remains impossible for many here. Dr. Mukonkole and his team are therefore still bracing for a tough few weeks ahead of them.
As the cold wave sweeps through Delhi and the sun disappears for days behind the thick fog, it is those without a home who suffer the most. According to estimates, about 150,000 people in Delhi are homeless, making them particularly vulnerable to the city's extreme climate. As the cold days give way to chillier nights, the homeless queue outside government-run shelters for respite. 52-year-old Pramod Saini is a migrant laborer living in Delhi for the past 20 years. The COVID-19 lockdown left him unemployed and without the resources to rent even shared accommodation. He ended up on the streets.
We cannot do without shelters when it's cold. During the summer, I can sleep in the park with just a sheet, because at least there's a cool breeze. In the winter, it becomes very difficult.
While Saini has been a frequent visitor to such shelters for the past few years, this year, he says, the situation is different. Everyone has been instructed to wear masks inside shelters, maintain distance and clean their hands as often as they can. The pandemic has posed a challenge for the authorities and civil society organizations alike, as it is not just the cold they have to protect people against.
During the summer, we could arrange for people to sleep in open spaces like parks to maintain social distancing. But during the winter, we have to protect them, both from the virus and from this extreme cold.
According to Delhi government officials, the capacity to house the homeless of the city in the shelters has been reduced from close to 18,000 to less than half of it to maintain social distancing. To make up for that, temporary shelters have also been set up in different parts of the city. Apart from taking other precautions in these shelters like conducting thermal screening and providing masks and sanitizers, isolation wards have also been created to accommodate those who show symptoms. Many social workers say that sometimes it gets difficult to explain the seriousness of the pandemic, as it is the basic day-to-day survival that takes utmost priority for the people who end up in these shelters, for which they are forced to step out in crowded areas to seek work. Dr. Sanjay Kumar, who has been working for the rights of the homeless for decades, has the same concerns. He says the government needs to do much more.
We need to do a lot more. We need to maintain more social distancing among them and encourage the use of sanitizers, because once this spreads among the homeless, it will get very hard to control it. It will go beyond our control, because we won't even be able to trace the chain of contact.
Saini says that everybody tries to take precautions as instructed by the shelter caretakers, but it is not easy.
Nobody can have a mask on for 24 hours. People do take them off at times or get together to just chat with each other. But it should be fine as long as we maintain some distance.
The coming month will be tough for those on the streets as the cold peaks, and will drive many more seeking a warm bed and a blanket to shelters. But for people like Saini, the hard reality is that surviving the cold at the moment is a bigger concern than surviving the virus.
Celebrating Christmas Eve. For the around 2 million Orthodox Christians in Germany, it's something of a challenge during COVID lockdown. Take the Serbian Orthodox Church of St. Sava in Düsseldorf. A year ago, thousands of believers came here to worship. Then they didn't have to register. But now the church needs to be able to contact them if a coronavirus outbreak occurs. This time, only a few dozen worshippers can take part in the service outside and a similar number inside the church. We have to keep the people safe. None of us may be infected in the church. We have to take care of each other. Social distancing, face masks, no hugging, nor any kissing of the icons, as is common practice in Orthodox churches. It's important that we abide by the laws of the state. At the same time, we have to do what God expects of us. And that is to take care of each other, and to show love to one another, and to be considerate. The choir has also been reduced to just a few singers. The faithful show their understanding for the security measures. Unfortunately, this is what we are living with now. We have to make the best of it. You can't go anywhere. That's how it is. It would be better if it was normal, but it's not possible. It's different from what was normal, but we still have to come here and pray. The custom on Christmas Eve includes lighting the so-called banyak, an oak tree. It's a reminder of the fire that warmed the place where Christ was born. But the authorities have forbidden that this year too. At least the faithful are allowed to light candles to commemorate the dead and to pray for the health of their families. It's certainly a different Christmas Eve this year, but some of the traditions have survived.
Let's take a look at other developments in the pandemic. The United States has set another daily record for new infections, with almost 300,000 new cases and more than 3,600 deaths reported on Friday. Australia's third largest city of Brisbane has entered a 3-day lockdown after the emergence of a variant first detected in Britain. Officials say it was contracted by a cleaner at a quarantine facility. No community transmissions have been reported. A new study published in the Lancet medical journal says most people hospitalized with coronavirus still have symptoms after 6 months. The most common ones are fatigue and muscle weakness, but also sleeping difficulties.